name's Michelle. Oh, there we go, the nice recording lady. I work for the Healthcare Consumers Association, and this is my colleague Nadia, who also works for the Healthcare Consumers Association. And tonight we're giving this presentation on a series called Managing Your Health. And tonight's topic is on dental and oral health with Dr. Sri. So first, I would like to acknowledge the traditional owners on the land in which we meet and pay my respects to elders past and present. And I'd like to acknowledge the ongoing connection to country and the richness and value that this brings to the life of our city and region. So moving on a little bit to just some quick housekeeping type stuff. Me and Nadia will do all the techie support and facilitating in the background. So if anyone's having any difficulty hearing or seeing, or the screen's not working, or any difficulties, just you can write in the chat or wave your arms around, or alert us and we'll get you sorted out. We usually like to try and keep everybody on mute just to keep the background noise out, so that everyone can hear. We're gonna have some question and answer type sessions in here, but if you have a question throughout, we're easygoing. Just feel free to put your real hand up, or you can put your online hand up, or you can type it into the chat. So if anything pops up that you think of and you're like, oh, I don't want to forget that question for later, feel free to just let one of us know and ask, or type it in the chat. That'll be probably the easiest way when the screen is shared. We'll hand over to Dr. Sri's presentation in 1 second, and he'll run through I think it's about 25 slides, and we'll stop for questions throughout, but then we'll have like a bit more of a Q&A at the end. There's a few little quizzes throughout as well, so I'll ask you some questions and you can click on the answer on your screen as we go. So Healthcare Consumers Association is a health promotion and health advocacy organisation. We're the peak body in the ACT, and we've been operating for 40 years in Canberra. That's who we are. We like to give these presentations for free, just to try and give people access to really good evidence-based health information, and partner with, the great businesses and clinics in the community. So I'll do a little intro for Dr. Sri. He has been working in the dental field since 2003, gained a specialist qualification in pediatric dentistry. I said that too quickly before and got all tongue twisted, but pediatric dentistry in India, and takes a keen interest in managing the dental needs of children. He's been working in Australia since 2010 and is a member of the Australian Dental Association, New South Wales and ACT Branch Advisory Committee, which discusses important policies which affect the oral health of the community. So he's very community-minded, very keen on how prevention, really good oral health can prevent further chronic conditions. So I will now hand over to the expert, so you can stop listening to me, blah, 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 and we'll learn some wonderful things about oral health. So I think I've got a quiz for about the third slide. So we'll try and get that up as you're talking so people can pop in their answers. Okay.
Sure. All right, Michelle, thank you so much for the introduction, and thank you for having me, and welcome everyone. Good evening. This is my first time presenting a seminar on Zoom, so forgive me if there's any hiccups. So I just wanted to have a nice informal way of communication. So if you have any concerns, please, or questions, please feel free to ask. I'll do my best to help. Otherwise, you can refer back to your regular dentist. Perfect. Now, this talk is inspired by Dental Health Week. So this year, or past year, so it happens every year in August. It is promoted by the Australian Dental Association. So the topic for 2023 has been mind, body, mouth, it's all interconnected, which is very timely and which is something that I'm passionate about. As Michelle said, I trained as a pediatric dentist in India, then wanted to move to Australia. So I qualified again doing exams as a general dentist. And since then, I've been working here, and I think my experience over the past couple of decades in various areas of pediatric dentistry and general dentistry helped me to combine all that information and help my clients to make those important decisions. Excellent. Now, so it's a bit of a philosophical. I hope I can move this slide. All right, good. Now, just a bit of a philosophical outlook. Okay, so every mouth shares a story. We all use our mouths for sharing a lot of stories, but as dentist, when I look into somebody's mouth, there are things I can look and I can see things which prompts me to ask those questions to understand more about my clients. Okay. Now, the question is, where does the story start? Okay. If somebody comes to me, or typically say couples who are planning to have children or women who are planning to have children, if they came and said to me, okay, so we are planning a family, or I'm planning to have a child, what is the best way I can protect my child's teeth? Okay. So most of it starts even before the mother conceives. Okay. It's the genetics. Okay. So we can blame a lot of things to genetics, but they do play a part. And whatever we are in control of, we can do our best to protect and prevent problems. Okay. So the growth and development of the mouth and teeth, they start around 6th week of intrauterine life. So it is very early. Okay. So if I can advise expecting parents, one advice, I will advise them to educate themselves about oral health and make sure that there's no inflammation in their body, because that's how things can start to get complicated for the embryo that's developing. Because as I said, at 6th week of intrauterine life, that's when the mouth is forming. The teeth are starting to get signals, and the new teeth are forming in the jaws. Okay, so that's where the story begins, even before we are born. Okay, the story of the teeth. Okay, so now I'm just gonna move this one. Yeah, so the health of the mouth, as I said, influences the body, and the body influences the mouth. So these are like, if we cut a tree, we can see a lot of circles. And recently I've been to caves, and the tour guide said that if you cut a stalagmite, there are different layers and which incorporate the mineral that's happening during that time of the world. Okay, so it's quite distinct, right? So there's a lot of influences that keep happening on the teeth that are developing, the developed teeth, the teeth that are present in the mouth, and the infection in the mouth further affecting some of our chronic medical conditions. Okay. All right, so this is an interesting slide. So almost half of Australians experience chronic medical conditions. Yet there's a lot of us who are not aware of that link. Okay. It's not necessary that we need to know, because we're never educated, right? So little secret, I went to a dentist when I was 19, because I used to think that going to the dentist was only to get teeth out. But I was lucky because the one thing I used to do every morning is brush my teeth before I put anything in the mouth. But what played havoc on my teeth was my aunt bringing a lot of lollies. I was chewing and crunching, and they used to get stuck in the teeth. So I should say I was really lucky going to dental school, because that's when I had my first dental checkup and then had my teeth filled. If not, they would have ended up with big holes and all of that, right? So yeah, so it is about having that that awareness and sharing that information, which helps each other to seek health or seek care in a timely manner so that we are preventing disease. Because the famous saying goes, a stitch in time saves nine. Okay. So prevention is really, really inexpensive compared to repair. Okay. Excellent. Now, so having spoke about the genetics and things like that, so there are a lot of things, as I said, they're not in our control. Okay. But what is it in our control? It is to gain knowledge. It is to then look after ourselves. Okay. So what we can manage is the damage to the soft parts of the mouth, damage to the hard parts of the mouth, as well as the saliva quality and quantity. Okay. When I see a new patient for examination in my practice, I speak to them about the biological risk. What is it between the interaction between the bacteria and the human body? What is happening to the hard tissues, which is the teeth? Okay. What is happening to our gums, the lining of the mouth? And the third important thing is the saliva. It is like the medium in which the teeth are present. Okay, it could be, so imagine you're putting iron in river water versus seawater. There, it rusts differently, right? So it is the environment. Okay. Now that's where there's a lot of interactions that happen between the mouth and the body and the body and the mouth. Okay. Excellent. Now, the first thing to look into is imagine as soon as we brush our teeth, okay, spotless, clean, okay. As soon as that happens, within the next 1 hour, 2 hours, bacteria slowly start to accumulate on the teeth surface, all right. The only time when there's no bacteria in the mouth is when we are in the mother's womb, okay. As we come out of the birth canal, we inoculate the microflora from the vagina into the mouth. Okay? That's the first step. The bacteria is coming to the mouth. And then as the baby is growing, it is about sharing the spoons and sharing utensils, sharing between siblings and all of that. That's how some of the harmful bacteria in the mouth, they get spread. So we say, sometimes we have clients who say, okay, my parents had gum diseases and I have gum diseases too. So it is that particular strain, that genome of bacteria which are present in one person's mouth, which get transmitted to the other. Okay. So that's why the parents' oral health is important, to have the children growing healthy.
I never really thought of that. So do you mean like if I had bacteria in my mouth and licked a spoon and then my little child was like, I want some of that yogurt, and I sort of went, oh, here you go. Yes, I'm just giving him the exact bacteria that's in my mouth. So needing to,
Yeah.
like, I mean, that's how you spread viruses. And I'm kind of like, yeah, okay, that makes sense. But I guess I never really thought of it in terms of spreading like things that could go wrong in their mouth from my mouth. I think,
So
yeah, that's really
it is,
interesting.
if you had a healthy mouth, there's a healthy
Well, I
bacteria,
hope so. But yeah, like I can,
then the risk of spreading is minimal.
yeah.
But if the mother or father or siblings, they have gum disease or decay and all of that, so there's
Hmm.
particular strain of bacteria which dominate to cause the.
Mm-hmm. Mm-hmm. Mm-hmm.
So when those bacteria then gets inoculated into the child's mouth.
Yeah. Wow. I'm gonna think about that more. Hopefully my mouth is healthy enough that I don't do that, but it's just
So there's
interesting.
vertical, yeah, it's called vertical transmission and horizontal transmission. Vertical transmission is from parents to children,
I'd
and the
hate to see
horizontal
the,
transmission is what
yeah.
happens at daycare.
Yeah, I was gonna say I hate to see the the horizontal transmission at daycare must be intense. Hopefully they don't have like too bad of gum disease at that point, but
Yeah.
yeah, interesting. Okay.
So coming back to, so there's commonly, okay, um, we kind of think, okay, what is plaque? What is calculus? Okay, so everyone talks about plaque. We see in advertisement, so a lot of toothbrushes, toothpaste, they all advocate, okay, use this to remove plaque and get rid of thing, da, da, da. So plaque is the soft debris. Okay, as soon as we clean, it's like plaque is technically it's like a biofilm, something which coats the inside of any pipe. Okay, so it's a biofilm. So in the mouth, that film is forming on the nooks and crevices in the teeth. Okay, and then we have opportunity to clean our teeth first thing in the morning and before we go to bed to remove that plaque. So if we are not able to clean it well enough, then it starts to build up into calculus. And this is here the dentist survive because the tartar is hard to remove by yourselves. So that's where the 6-monthly clean or 9-monthly or 1-yearly dental visits will make sure that the tartar is all removed. Because if the tartar is left unattended, under the lower layers of the tartar, because it's not being removed, there's a different kind of bacteria that starts to grow, okay, which are more virulent. So, and they're more damaging. And that's what causes the gums to start to get inflamed. And once the gum starts to get inflamed, we start to notice the inflammatory mediators. So those chemicals, which are then released into that area. So that's the main area where the body affecting the teeth and gums and the teeth and gums affecting the body happens. Okay. So in healthy individuals, as the plaque is accumulating, the body has enough defense mechanism to identify that there's an invader near the gum line. Okay. So now I'm just going to mark here. So this is the gum sulcus. So that little groove. Okay. As soon as something is sitting there, then the body identifies that, okay, there is an invader. We need to send defense cells. So the defense cells come into that sulcus and then they fight with the bacteria and the bacteria just get mutilated. Okay. So some of the diseases are the signaling system is hampered. So the signals are blocked. So the body, the defense cells in the body, in the blood, okay, they're not able to get that information that there is an invader. So the bacteria keep multiplying, irritate the gum, the inflammatory mediators are secreted, and then they cause damage. So that's where the diabetes typically causes more gum disease because due to that vasoconstriction, which we see in diabetes, as well as the defense cells not being very active. So yeah, so that's the main concept between a lot of medical conditions. Okay, the immunity. So that's the biological risk. Okay, so people who are more prone for gum diseases, we classify them high risk for gum diseases, and we like to see them more often because we are cleaning their teeth more frequently rather than somebody who don't accumulate too much plaque. Alrighty, so let's move on. So this is the sulcus that I was talking about. Okay, so that's healthy sulcus. All right. Then as the bacteria accumulating, you can see that there is the redness there of the gum. So sometimes clients might say that when I brush my teeth, my gums are bleeding, and they brush their teeth less, thinking that they're damaging their gums. One, it is signaling that there is gum inflammation. It's a good sign to see the dentist. Two, if you can't readily see the dentist, continue brushing because if we don't brush enough, then it just keeps accumulating more and more. And then it creates a deeper problem. Now, so when the gums are red, we call it as gingivitis. Now, if the gingivitis is not treated and then the tartar is not cleaned in the timely manner, the chemicals that are secreted here, they damage the bone. So the bone is the anchorage for the teeth. Okay. Now, in the deeper layers, so that's what we call it as a pocket. As you can see here, that's a measuring tool that we use to measure how deep the pockets are for our clients. Now, as you can see here, as we are going into the black band, there are deeper pockets, and in this base is where there is more dangerous bacteria, okay, which quickly degenerate. And then you're seeing that the bone support is going down and down. And as that happens, the teeth start to lose their anchorage. They start to become more loose and wobbly. So that's the whole scenario of gum disease. And imagine one, so it happens throughout the mouth. Sometimes it happens localized. So the reason being that one tooth might be in a different position, and as we are chewing, it might have more impact. That's a physical trauma. This is like a pathological trauma. So that, in addition to that, because the tooth is in an altered position, it's difficult for us to clean. So there's more bacteria accumulating in that spot, and then it leads to further complications, gum disease or decay.
I feel like when I look at that little measurer stick, I feel like in my mind, I can almost feel what it would feel like to poke that into a sore spot. And I'm all like, oh, it looks
Definitely.
painful, even just looking at a picture of a cartoon of this level of gum disease.
Definitely, because I'm quite cautious when I'm looking, because I inherently feel that I'm hurting somebody.
Yeah.
Because it's like a pocket, it's like a pocket in your shirt.
Mm.
So we are not trying to create a new pocket. We are just kind of like gently dipping in like
Yeah,
like a dipstick. So
yeah.
we are putting like a dipstick into the gum
Yeah,
sulcus.
yeah. That's exactly what it looks like. Yeah. Yes.
Excellent. So let's move on. Now, the next concept is how does decay happen? So we've looked at the gum disease progression and what is needed for the gum disease to happen. Now, the next one, decay. So for decay to happen, we need bacteria, we need some food for the bacteria, because the bacteria can feed on that food and then spit out acid. Okay. And when that acid stays for long, it slowly damages the enamel, the mineral of the enamel, and it creates a little window. So it's funny. Imagine the enamel being like a hard sponge which is filled with mineral. Okay, so this acid is going and leaking out that mineral. Okay, and then there are spots where there's not enough mineral, and the bacteria will kind of like go in. And then they start to feed on the protein in the tooth. And that's how the decay spreads. Okay, so basically for decay to spread, we need bacteria, we need a sugar, and that sugar is converted to acid by bacteria, and the time is critical. Okay.
What time frames are we talking here? Like, is this the 6 monthly kind of? How long would this acid plus teeth plus time take to get tooth decay, or is it
Good
just
question.
dependent on how long's a piece of string, how good is genetically your enamel, and lifestyle factors and all sorts of things? Fair.
Good question. So now, if we are exposed to acid, okay, the sugar getting converted to acid, it takes half an hour for the
Oh,
natural repair to start. Okay, so as
right.
soon as there is acid in the mouth, the balance in the mouth starts to kick in. Okay, so one way of that what happens is the mineral from the teeth is leaked out
Mm.
to establish that balance.
To re-establish a neutral, yeah, I get what you
pH
mean.
in the
Yep.
mouth. Yeah. And then,
I've got a question.
yes,
Oh,
Yeah, the question I had, someone once, I think they were natural health, but they were having lemon juice like early in the morning, like first thing. Is lemon juice a risk for dental decay?
good question.
that's
So,
a really good question. Yeah.
yeah. So, so it's the enamel, the acid, bacteria. Okay. So when there's bacteria, there's a hole that's forming. When there's no bacteria, there's still acid. And if that acid is staying there for long, so we spoke that it takes at least half an hour for the mineral to go back into the tooth. So initially the mineral is coming out of the tooth, and then once the acid is buffered out with the help of saliva and all of that, then the mineral is going back into the tooth.
It
So
like
that's the repair.
reforms. Yeah.
So the repair is happening. Now,
Right.
if we don't allow this repair to happen by continuously snacking or food stuck in between the teeth, or sipping on some cordial, or a baby having a bottle in the mouth, so that time factor, it will make it hard for the repair to happen. So there is only one-way traffic. The mineral is going out. It's not coming back. So that weakens the enamel. And then when we come back to the other source of acid, which is typically the lemon juice, okay? There's no bacteria. Imagine somebody had a clean mouth. They're having lemon juice or apple cider vinegar, or it could be orange juice or something. And as soon as that hits, there is citric acid. So it's soda. There is carbonic acid in soda.
Yeah.
Anything that fizzes, it has a low dose of acid.
Mm-hmm.
Now, when there is that prolonged effect, the remineralization is not happening, the enamel thins down. This is called erosion. So imagine that slab of enamel, it's kind of like slowly microns of enamel is getting washed out. So that's what happens with acid. Now, coming back to having a lemon first thing in the morning, I was listening to a podcast this afternoon in my walk. That's what the author recommended. So have a half a slice of lemon juice if you are under 150 pounds. It's an American author. And dilute it with water. Okay, so it's beneficial for digestion. Okay, so if I was to have it, what I would do is I wouldn't brush my teeth for at least half an hour, so that I'm allowing that remineralization to happen, which means that as soon as I have something lemon juice or apple cider vinegar or something like that, so the acid attack, I'm rinsing my mouth, just being careful, but I'm just waiting for half an hour for the mineral to go back and repair.
Right. So if you've got a healthy mouth and you have acid, if you just give your mouth some time, it will just go back in with your normal processes.
So
right.
and a lot of people have orange juice in the morning.
Yeah.
Breakfast.
Mm-hmm.
So growing up culturally, I was taught to brush the teeth first thing in the morning before anything goes into my mouth. So, but my diet was not sugary, it was mainly pulses and kind of like Indian breakfast. Okay, there was no sugar. But if we didn't brush our teeth and we had breakfast first, and then if it did involve orange juice and juices and things like that, we would wait at least half an hour to
give it some time. Yeah. That's
and
really
then go out
interesting.
to work. Yeah.
Did not know that. Does that answer the question? Okay. Murray?
So
Yep.
I think it seems like it's well, as long as you're a bit careful, it'd be okay.
Yeah, and wait half an hour and then the minerals will go back into the enamel. Seem to be the general gist.
And the thing is that there's a lot of activities that we do every day, right? There's acid exposure. So it's kind of like clubbing with meals and having that bigger window. For example, if somebody said, okay, so I like to have Coke in my lunch, so I can't ask people to not have anything sugary or acidic or anything like that. So try not to have it for a prolonged period of time. So sometimes it could be as simple as someone having orange juice one afternoon while they're working, and then they might take 2 hours to finish off the oranges. And that habit over a period of time, I have seen how it affects the enamel. So it erodes the enamel. Similarly, somebody might squeeze lemon into their water to flavor it.
Oh, yeah. And then drink lemon water all day, like little sips of acid all day.
Yeah, or they might be going on a hike and they are dehydrating. There's not enough saliva.
Yeah.
Now hike, they're going for a hike, and then there is acid, there is dehydration, there's no buffering in the saliva, and that damages the enamel significantly over the years.
Yeah. Okay.
Excellent. Alrighty. So let's keep moving. So this is
Oof.
a slide which shows different stages of decay. Okay. Now, initially, there are so these are the grooves which are in our mouth, right?
Mm-hmm.
So these are the traps for bacteria. So that's where the brushing, the scrubbing is important, because we want to get rid of food from those grooves and those areas, because as food gets stuck here, and if it's not removed, then it starts to cause decay. So that's so we have bacteria, we have a medium there for the bacteria to feed on, and then we are giving time, and that causes the hole to form. Okay. And as you can see here, it's getting advanced. Okay. So initial decay, so we are mainly waiting for the body's capacity to repair those lesions. When I see clients, we ask them to use high concentration fluoride toothpaste. We do fissure sealants, and we try and eliminate those grooves. Imagine if I had fissure sealants as a child, my auntie's lollies wouldn't have caused decay for my teeth. So that's how those fissure sealants will seal off these grooves and avoid food from getting caught into those molars. Okay. Now, as the decay is advanced, they get into the nerve chamber, and there is that inflammation happening. For gum disease, the inflammation is happening external to the tooth. Okay, so that's where the damage is happening external, and it's very slow. It's very hard to identify until the teeth are starting to become wobbly, or if somebody says that, okay, you're having a bad odor, that's what prompts some people to come and see us. Sometimes they do notice the gums getting inflamed, and they get alarmed by what's happening, and that which prompts to see us. And with decay, what happens, because it's internal, it's going into the nerve. And once it goes into the chamber, there's inflammation, and there's no way for that inflammation to go. Because it's like in a closed confined cavity, it's like a pressure cooker, which then causes that toothache. That's why people have excruciating toothache when that decay hits the nerve chamber. All right, so now we did speak about saliva. Okay, so now saliva, the flow of saliva is affected by our age, our salivary glands. If we have any problems with the salivary glands, then our saliva gets affected. Due to the slowing down of the salivary gland physiology, our salivary flow might reduce. If we are taking medication, more than one, often they have side effects which cause the dryness of the mouth. Then we have it's physical, psychological, okay, pharmacy. Okay, it's mainly, and then stress, anxiety does cause our mouth to dry. Imagine going for an interview, need to do a presentation and things like that, so our mouth dries up. That's the nervous system, which is affecting the glands. Okay, so why is saliva important? Saliva has enzymes which try to check bacterial growth. They have other enzymes which help to digest our food. In addition to that, there are enzymes which kill bacteria, which make food unavailable for bacteria. Then saliva is a natural cleanser. If we have enough amount, as we swallow, the bacteria, the debris, everything is just getting flushed out from the teeth. Then saliva has buffers, so it has bicarbonates. So it is in a neutral pH. I think the pH of saliva is probably around 7.2. So it has a neutral pH. So it has buffers, it has that bicarbs. So that's what comes into help when we have something acidic. Okay. So if we don't have enough saliva, what happens is there's more plaque accumulating. The acid is damaging our teeth. The mouth is not getting lubricated. So we might have develop ulcers in the mouth because if we are eating a bread or a biscuit or anything, the crust is still sharp and then it might abrade the gum line. So there's a lot of things which determine the salivary flow. So the main, this is where the chronic conditions, the medications that we take directly affect our oral health by reducing the salivary flow. Okay. Now, what do? We can't stop having medications. We need to have medications that are prescribed by the doctor. It is about then seeking help regularly from the dentist, making sure that the teeth are not getting decayed, the gums are not getting inflamed and damaged. Using products which help to substitute the role of saliva. Okay. Drinking plenty of water. Sometimes it gets hard because obviously drinking more water means using the bathroom more frequently, especially nighttime. So this is where we rely on other adjuvants which can help step into the role of saliva. Okay. Now this is a slide which shows how different chronic medical conditions are connected. The main factor is the inflammation. So there's inflammation in the mouth. The chemicals which are released into the bloodstream, they travel through the blood, reach brain, heart, different organs. The bacteria could be traveling through the bloodstream. So that's the main concept. For some diseases, there's strong evidence. For some, there is emerging information that it's interlinked. Especially, I attended a recent seminar where there's a strong link between Alzheimer's because there's inflammation in the brain, layers of the brain. And some of them are like if we're not having enough saliva, we're not able to swallow the debris from the mouth, and which in turn builds up more, and then we are suddenly aspirating it into our lungs, and then we have a big focus of infection in the lung, leading to lung infections. Yeah. So and then I think there are some studies where they have done histopathological sections on placenta, and then they identified bacteria. So low birth weight infants.
Yeah, I just had no idea that this never really occurred to me that the stuff going on in your mouth, like it makes sense when you think about it, but could end up in your bloodstream and end up affecting the organs. Like I guess you think of the mouth as sort of a different system somehow, but yeah, that's really
The
interesting.
gum sulcus is the barrier.
Yeah. And it's like
where all the exchange is happening.
just here. It kind of makes me, yeah. Yep.
And women, when they're pregnant or around puberty, the estrogen hormones, which is particularly more, becomes more susceptible for that inflammation.
Yeah, I had that. I sort of felt like after my pregnancies, I ended up getting 2 or 3 more fillings than I would have normally because it just all sort of unraveled a bit during that year-ish time.
And there's a couple of important things. Thank you for raising up that discussion. One is how the hormones affect the gum health because they make the gums more susceptible for inflammation. Two, the nausea and vomiting.
Yeah, I was going to say,
So
I think it was
nausea, it's nothing but the stomach acid coming to the mouth. And that's again, it's highly acidic. It's like pH of 1 or 2 because it's used for digestion of the food. And imagine that coming to the mouth, and it's highly acidic and you damage the enamel. And if we are worried about brushing and then there's food getting caught and then it all together leads to those
it's like a concentrated time for potential oral health problems.
Yeah, and I tell my clients, if you are vomiting, don't brush your teeth immediately after you vomit. Rinse your mouth with bicarb soda, just bicarb soda. Make a solution, tumbler of water, rinse frequently.
To
That,
give that enamel a chance to re-establish.
yeah, and to neutralize the pH in the mouth.
Yeah, right. Yeah, okay.
A lot of times people feel yucky after they vomited, and then they brush, and
Yeah. Yep.
the enamel is kind of like eroding away.
Interesting.
All right. So as I said, there's strong suggestion between diabetes and heart diseases and gum diseases. So, so what we notice is, especially the gum disease and diabetes, it's like egg or chicken first. So both of them have to be managed thoroughly to get a win, to get a good blood sugar control as well as to get a control on the gum disease. It's not one first and the other next. As I said, there's growing connections between Alzheimer's, adverse pregnancy outcomes, and aspiration pneumonia. Again, gut disease. So you're swallowing that bacteria, and then it's getting into the digestive tract. So, from a dental perspective, from chronic medical conditions, our main goal is how are we managing the biological risk? How do we equip our clients to be able to look after themselves at home? If they have arthritis, sometimes it might affect the grip of the toothbrush. So whether we use manual brush, we use electrical brush, how are the medications affecting the oral environment? What extra precautions they need to take? Yeah, so we are mainly prioritizing because often when I speak to doctors, I tell them, so we are actively controlling their chronic medical condition, but sometimes they might be losing their smile in that process. So, the oral health is a good support, and because it deals with the self-esteem. Imagine somebody being managed for mental health conditions, and they're taking all the medication which dries their mouth, but invariably they're causing decay and all of that. So, how will they get that self-esteem to seek a job if their teeth are damaged?
Yeah, that the confidence around your face and your mouth being a focal point of your communication can be really affected by different oral diseases. That's really true.
Excellent. So a couple of slides in regards to how we need to look after our oral health. So what kind of toothbrush do we need? So most of the times we say soft to extra soft bristles so that we're not damaging the gums with excessive brushing. Even near the neck of the teeth, the enamel is very thin.
Yeah, I'm guilty of that. I think harder is better, but brushing harder is not better, is it?
Yeah, and that's when I recommend clients to use electrical brush with a pressure sensor.
Yes.
Brushing harder, it beeps and then it lights up.
You remember not to press so hard. Yeah.
Hard. Yeah. So we want to aim the bristles towards the gums because it's like imagine nail bed. It's like cleaning the nail but forgetting the nail bed. Okay, so we want to aim those bristles to clean that area there. Okay, because social media, TV, everything, advertisements, we are shown that you need to brush like that. So with that, only this part is getting brushed, but the plaque and tartar is sitting on the gums still.
That's the crucial area, the top where it's meeting the gum.
Yeah. And if we press it enough, then the bristles are going in between the teeth. and then they are agitating the plaque that's sitting there. Okay. Now, so in terms of fluoride toothpaste, as soon as a child is able to spit out, then a fluoride toothpaste can be used. So we are living in a fluoridated environment where the water is fluoridated. So the most significant amount of fluoride benefits when it's incorporated when the teeth are developing. So the crystals, the enamel crystals, are more resistant to acid attack when that fluoride is incorporated into a developing tooth, because the majority of the mineral is formed in the womb for baby teeth, and then once the child is growing. So natural tap water, it's good to have that fluoride. But because toothpaste has more fluoride in it, so that's why we want children who are able to spit to use it. Otherwise, there's going to be that ingestion.
How bad is eating fluoride toothpaste for kids? Like, say you had 3 boys who maybe regularly ate the toothpaste. Would that be really bad?
So here we are talking about the toxic concentration.
Right.
So that's why we don't use fluoride tablets. Previously, they used to use fluoride tablets. Where,
Too much fluoride is not good.
Yeah, so fluoride tablets where people didn't have access to community water. So if they had living out of town, so they used to provide tablets. Those people used to put those tablets, and that would have sometimes caused accidental ingestion of fluoride, toxic levels. So it affects the bones and all the minerals.
Okay.
Fluoride gets attracted to mineral.
Right.
Anywhere there's mineral in the body, fluoride goes there. Excellent. So it's good to replace the brush every 3 months. If you are needing to replace it more frequently, it's a good idea to think about the technique. Now, so this is very, very important. In addition to brushing, cleaning in between the teeth is very important. So the people give crude examples. I don't want to give a crude example now. So it's of missing between the teeth. So floss is good. If there's too flat surface, floss is good to clean. But as soon as there's gap, as you can see here, there's gap in between these teeth. We won't be able to clean just with floss. We need a brush like this. So they come with different sizes. So at the dental appointment, we usually size up those brushes.
Yeah, because if they're too big, it can be a bit
They can't
painful.
go in. They
Yeah.
can't go in. So they're like it's just like cleaning a bottle. So they gently need to slide in and out.
Yeah, like a bottle brush. Yeah, I get it.
Bottle brush. So what happens is these bristles, they're going into those grooves because if you look at the inside of that area, it's going to be like concave. So a floss can't clean this bit. It'll clean this bit and this bit. So, but a brush, the bristles in the brush, they'll go and clean that concavities that we see in the root surfaces. Now, when you're flossing, we want to create a C shape. So we are cleaning, like imagine you're cleaning a pillar. So, okay, so that's how the floss needs to curve around surface.
Yeah, I get you.
If we just insert it, we'll be hitting the gum and then it'll be ouch. So we need to get it in.
Sort of.
And move it to the side and then clean it down. So as you can see here, they have inserted it and then they are wrapping it around the neck of the tooth and going up and down.
Yeah, it's a good visual.
For the brushes, for the back teeth to reach it so they can gently be bent. Right, so in terms of dentures, okay.
Question was about water picks. I mean, I started using water pick in the last couple of years, and I think it's been pretty good, actually.
Yeah, definitely. Good. Good. So interdental cleaning is better because we are physically removing bacteria. With the water, it can't physically remove the bacteria, but what it is doing is the toxins that are liberate, or the toxins that are released by the bacteria, they're getting washed out by the water pick.
Mm.
So that way, it's a win. But definitely, if you can use the fixed interdental cleaner, that's better. But if not, using the water floss is definitely recommended because it's helpful.
Yeah.
Excellent. I think I'm not sure if this slide is gone. Yeah, dry mouth home remedies. So we spoke about cleaning and all of that. So there's different things to avoid in order to avoid dry mouth. Avoiding caffeine, too much caffeine, sugary drinks, smoking, drugs, alcohol. Do drink plenty of water, sip water as you eat, chew sugar-free gum. Again, sometimes when we ask clients to chew sugar-free gum, they might do it more and then they might hurt their muscles and jaws because too much work on the muscles and jaws. So the xylomills is something that you can stick to the inside of the cheek for people who experience dry mouth. I've had a lot of clients definitely benefit from xylomills because they just stick it on the inside of the mouth before they go to bed.
It's at night, isn't it? Yeah, I recently bought all of these products for my child who's on a medication that dries the mouth. So we've been trying these all week. I wish the Xylee melts came in smaller sizes because they're more like it's too big and he can feel it. So I've been trying to poke it in while he's just falling asleep, but he keeps finding me out.
Yeah. And I think you could try the so this is the oral 7. So they have that active enzymes which help to step into the role of saliva.
Yeah, we've been doing the gel the gel one's quite good.
Yeah. And as well as that, so there's a spray. Now it's coming in the spray bottle. Okay. The other way is even the mouthwash, you can decant it into a spray bottle that you can get it in a Kmart.
Oh
So
yeah,
you
like the little
can-
travel, like the little travel size ones would be good.
Yeah, spray and then use that intermittently during the daytime.
Yeah, that's a good idea.
So that you're having that supply.
Because that brand has the enzymes in it, doesn't it?
Yeah.
That have the same as saliva. So it's like, yeah.
We
Oh,
have a
we have
question.
Catherine has a question. Go for Catherine.
Our dentist recommended mouth taping. I know it sounds awful, for as part of dry mouth, particularly overnight. And seems to be working quite well actually. And I think it's for my kid, it's sort of I don't know, bringing the mouth together a bit more so that it's easier to not be as wide open during the day all the time. Like I was a bit not that keen on the idea initially, but yeah, but it does seem to be helping.
As in like taping the mouth shut with like a soft tape while they're asleep.
Yeah, just taping from just underneath the nose.
Like that.
Yeah, like that. Yeah. So you can still open the mouth a little bit from either side. It's not like if you were kidnapped or something and taped right over your mouth, but
No, to prevent sort of falling asleep and being like,
yeah, exactly. Yeah.
yeah, my kids do that a bit too. Yeah, okay. What's your thoughts on that?
Yeah, I'm interested to know what you think.
I have never recommended that to my patients because often what I find is if they have obstructed airways, they depend on their mouth to breathe. So I think I'm not the best person to give the advice about mouth taping. So probably it could be the ENT or pediatrician, or it could be the sleep physician.
Yeah, so you really want to know the reason for the mouth being open and address that before going to the step. Yeah, I see what
I
you mean.
know even adults tape their mouth because they're snoring, so they're breathing with their mouth open. So I haven't researched into that.
Yeah, no worries.
To advise.
All right.
I personally, I wouldn't do it for myself
Yeah.
because I used to snore, and I went to my ENT to get it checked and got my nose corrected so that I'm sleeping better.
Yeah.
Okay. Thank you.
Excellent. That's all right. Thank you. So there's different products. So I usually recommend Xylymils and Oral 7 for my clients because a lot of them have found that very useful.
I think it's working so far.
Yeah, it's based on the feedback. So in the past, I used to, before I knew about Oral 7, I used to recommend Biotine, but it was mixed feedback. Some clients who used to use Biotine now use Oral 7, and they find that it's more beneficial for them.
I thought the Biotine one didn't have the enzymes. Does it have it as well, or it doesn't? It's just more of a moisturizing spray.
Moisturizing and chemicals. So
Yeah.
it's enzymes.
Different. That's what the chemist told me. Yeah. Yeah, that's good. That's good that the chemist told me the same thing you told me. That's helpful.
Excellent. Alrighty. So now the key for everything is having a balanced diet. So we can talk a lot about balanced diet. So it's kind of like having everything in moderation. So usually when I do a talk in kindergartens and primary school, we speak about traffic lights. Red is foods which are rarely eaten, which is like high sugary content ones, very special occasions. Yellow is like the muffins and cakes and all of that, which are sometimes food. Green is fresh food, freshly cooked food, vegetables and protein and carbohydrates. I guess the most important thing is to read the label for sugar as well as acid, because a lot of times I haven't done much research on Gatorade, Powerade, and all of that. So I know schools and gymnastic centers and all of that have them sitting there.
Yeah, it's very common in sports to
And
have
when
those kinds of drinks, isn't it?
and my kids keep pestering me to buy some.
Yeah.
And I find it hard because so there is caffeine, and then there's acid. Yeah, so I know cyclists who have used those electrolytes and all of that. They have erosion, which is dehydrating, and then there's acid. So yeah, so I need to do some research in that area so that I can advocate for them to be removed of the canteens in schools.
Yeah, potentially. Dalal has a question. Have you got time? Is it the one on the chat, Dalal? Do you want me to read it off there, or have you got a different question?
Oh, it's a different one.
Okay, go for it.
You're talking about dry mouth.
Oh,
so
yeah.
with our community, they've got a lot of saliva.
Oh.
And it's like constant drool. And for some, it's like constant drool, like into their teens and, early adulthood. And for some, it sort of tapers off. And so for those families, it's like, so what do I do for my kid who drools a lot, who has excess saliva, and some have gone down the pathway of having surgery or having Botox.
Oh,
But
okay.
in terms of oral health, I don't see a lot of saliva as it being a bad thing. So what would you say to a family who's caring for a young one who's got a lot of saliva?
Good question. I haven't thought about it, to be honest. So I know that dentists sometimes they prescribe medication for people who salivate a lot to do the dental treatment, because it could hamper with the treatment, like things like atropine and all of that. But again, it has other effects on the nervous system. So I think the GP would be the best person to see if there's any medications that are required.
But having a lot of saliva is not necessarily a bad thing for your teeth. Like, it doesn't seem to, you wouldn't say that you see people regularly who are like, this is causing me a dental problem. It's more people just, yeah, okay. That's really interesting.
And what happens is with the saliva, there is calcium in the saliva that gets deposited on the teeth, and they quickly develop that white color tartar. Because tartar is black as well, which is around the gum and underneath the gum, and which is harmful. The white
Okay.
tartar, which is very powdery, like it can be easily scraped off. So that's what we see in people who salivate more.
That's quite typical of my almost 10-year-old. She's got a lot of build up. And no matter how much I brush her teeth, floss her teeth every day, she still gets that build up. And I think it's because of a lot of the saliva.
In the saliva that gets deposited into the grooves in between
Like
the teeth.
extra mineralization almost. Yeah.
And what I usually tell clients is, especially the back of the bottom teeth is where there's a lot of tartar that builds up. And
because it's pooling,
and it's very hard to maneuver your elbow, joints, and everything to get there. So instead, bending the head down and opening the mouth will allow the teeth to be more parallel to the floor and easily reachable. And cleaning that way will help to
get to those spots at the back.
Yeah, because those grooves in between the teeth are typically where the tartar builds up. So it's the bristles going along those teeth, long axis.
I've just got a general question.
Yes.
One of my thoughts is just, it seems like your topic, like it's really important, that sort of oral health education, but in our system, because dental health's not part of Medicare, a lot of stuff falls through the cracks. And sort of like, because my father was a dentist, and I just educate people I know just about dental health, but it's just really missing, it seems to me. And with Medicare, no priority, and then people end up in hospital with really bad chronic, disease, and like that's more expensive than treating it properly in the first place.
Exactly.
Yeah, absolutely.
So when I used to work, I worked for 8 years with New South Wales Health, and as a community dentist, sometimes it's very disheartening because there's not enough of us. And then when we get to see people, the teeth have damaged too far. And as part of the education, I used to talk to junior doctors and specialists. We used to have grand rounds. So there's a ANU Rural School in Goulburn Based Hospital. So we used to have those lunchtime talks about these interactions, and I think there's not enough covered in the medical degree. I'm not sure how much of
Yeah, well, they had a thing on, Michael Mosley had a thing on sleep recently, and they said that
I love him.
the
Yeah.
the CPAP machines were sort of prescribed because doctors were in charge of it, whereas the dental mouthguard option was being missed because doctors were usually involved and not dentists. And then some of the people in that program couldn't use CPAP machines, but they ended up with a dental guard that worked for them.
Yeah. So it's called the mandibular advancement splint. So
mandibular advancement splint.
Yeah.
So the obstruction in the airway is caused here. So if you move your jaw forward, that's where the throat opens up. So some people have small lower jaw, which is kind of encroaching on the throat.
Right.
So letting the jaw to be positioned forward will help. So again, so sometimes I find it hard to refer patients directly to a sleep physician or ENT. They have to go through the doctor pathway because of the Medicare rebates and all of that.
Yeah.
And if somebody comes to me and asks me, okay, I need a mouth guard for sleep apnea, I have to see their sleep study, and I have to see a recommendation from their sleep physician before I can make one for them, because we want to know if it's going to work. And that's where the sleep physician play an important role.
So it's about them being aware of the options rather than just immediately CPAP. They
Yeah,
have.
usually sleep physicians, they do recommend a mandibular advancement splints
Okay. Yeah.
in mild, moderate, but again, there might be there's lots of bias in healthcare, so
Yeah.
you
Yeah.
never know what kind of bias.
That's
going
true.
on.
Yeah. Do CPAP machines dry the mouth out more than
They do.
they
And some
do?
of my clients who use
I should tell.
Xylomols are the ones who use CPAP machines.
CPAP machines. Yeah, right. That would make sense though, because it's doing air into your mouth all the time, isn't it?
Yeah. So I guess when I typically in our practice, we are treating people based on their risk. Okay, we have people coming back every 3 months, 6 months, 9 months, 12 months. So it is based on their individual risks, and just having that care continue, because we never know when a small modification in our lifestyle or some health fad online could change our oral environment and put us at risk for dental problem. So
Yeah.
we take x-rays for our low risk clients. We take x-rays every 2 years. Most of the times there's nothing, but sometimes we do find significant decay which has developed in the last 2 years. So that's why I know clients starts to get apprehensive about, okay, do I need x-rays? There's nothing seen. I'm spending this money to get x-rays. It is better to have them and then don't need any treatment rather than not have them and then at some stage need massive.
It's so much worse. Yeah. Yeah, they do add to the old dental bill though when you get those done.
Yeah. Excellent. Thank you so much
Mm.
for your patience. So that looks like it's an old photo. Some of the team members have moved on in their life, became nurses, and yeah.
Yeah, that's
Excellent.
all
Any
right.
questions? How did everything go? How is
If you
everyone
want to just do the stop sharing, then everyone's face will get bigger and we can see
sure.
each other, if that's okay.
So
Somewhere
there
up
we
the top in the
go.
middle, yeah. Then it'll go back to the all right. I do have a question from the chat that I can kick us off with. Do you want to say it to Lal, or do you want me to read it out? Are you happy to do it?
Yeah, I can
You do it. Yeah.
Yeah.
All right.
So our patient organization supports families who have a loved one with an ultra rare genetic condition called SATB2 associated syndrome, and they are predisposed to having poor root formation, lots of dental issues, missing teeth, so on and so forth. They also have other challenges, some cognitive challenges, some sensory, some coordination issues, and a lot of them are diagnosed with autism, ADHD, and so on and so forth, who are also nonverbal and have a high pain tolerance. How would you, or what would you advise their families or the individual themselves as to the best way to take care of their teeth at the early stages?
I'm guessing teeth brushing time would not necessarily be their favorite time.
Well,
in their household.
I'll put it out there. Naomi's teeth get brushed every single day, at least twice. And that's because I've had my hand in her mouth since she was a little baby. And that's partly because she's had a cleft repair, and so nasal regurgitation and the whole feeding issue. So she's used to having a nurse, but more so mum in her face, smelling and cleaning and flossing and all that kind of thing. So in Naomi's case, I'm thankful that she's okay with teeth brushing and flossing. However, it does become an issue when she goes to see a dentist, and it's just that sensory overload and the fear of unknown. So she needs someone that's, specializes in special dentistry.
Special needs dentistry.
Exactly. And that's Naomi, but there are many of our families who go days without being brushed. And I hate saying this, but their family have to pin them down to brush their teeth. Some are not getting their teeth looked at all, and they're getting older and teeth are getting pulled out, and recurrent abscesses. Naomi gets recurrent abscesses, not so much because of decay. She's got, thankfully, all her teeth are healthy, but it's the root formation and the grinding and the
Other associated things.
Yeah.
It's a tricky kind of area, isn't it?
I know, I'm sort of, giving you a whole heap, but I mean, anything that would help sort of start the conversation, because as soon as I say oral health, although so many families ask and for help,
Need help.
I say there's a webinar, for example, today.
Yeah.
It turns up, which is quite disappointing, because they're
I
the ones who need
know.
help. So
I have to say, it's not the most popular topic to sell, but so important and so valuable. Yeah.
So
anyway,
important, and so links to every other part of the body. But yeah, sorry.
What do you think, Dr. Sri?
It's a very important question, and a hard one to answer, because there's a lot of layers involved. The first thing is having access to that care.
Yep.
And when I say access to that care, is access to those health professionals who are qualified to support those families. Because here time is a factor. Education is a factor. So the first thing is, if they are eligible for ACT health, all children are eligible for ACT health, ACT dental health. I think under 14, I'm not quite sure. So starting off with ACT health, because obviously there is that interdisciplinary communication between different health professionals in the ACT health domain. I'm not sure if they have access to pediatric dentists in ACT health. Then there's oral health therapists in ACT health who may be trained to look after or educate carers. Yeah, so
it's a really hard one.
It's a hard one, because I used to work in Westmead Hospital, and the only way,
Pediatrics or adult?
there's a special care unit in Westmead. So a lot of times clients had to be treated under sedation. So it could be oral sedation, or it could be IV sedation. And we have Dr. Peter Wong. He's a private pediatric dentist.
He's Canberra based. Dalal is Sydney based.
Okay.
Yeah.
So my daughter goes to see Professor Richard Widmer at Westmead Children's, and when she does need things happening, she has to go under, she went under for about 4.5
So Sharon Alexander, Neeta Prabhu. So I met them when I first came to Australia.
Yeah.
So because I qualified as a pediatric dentist, but now I'm not qualified in Australia.
Right.
I'm not a specialist, so I met them back in 2010.
Okay.
They have special needs. There's Dr. Avanti Kare. I think she's the head of special needs dentistry in Sydney Westmead.
Yeah, it's a tricky one, trying to find little tips for home, but then also accessing that specialist care. So when things do escalate.
And it could be as simple as so I see elderly patients in the practice, and their children bring them. They're in aged care facility, and so they are not able to brush their teeth.
Yeah, the dexterity and the grip strength might be different.
Difficult.
So sometimes they'll forget brushing their teeth, and there's no one who's going to remind them. So sometimes I ask those staff, are you able to use an electrical brush and brush their teeth? So
Coco Melon videos, I find those help with my 3-year-old. Coco Melon brushes his teeth, then Jude will brush his teeth. But yeah, or finding all those little tips and tricks.
Yeah.
I think in terms of brushes, there's a brush which has 3 heads. So which
Yeah.
one?
Oh,
I've
a
seen that
3-headed
one.
brush.
Yeah. It's quite big though.
Yeah, right.
That's the only thing that I just, nah.
What
Because I
Dr.
wanted
Sri,
to.
what do you think of those ones that you put in your mouth and you turn on and they just vibrate
The
and they
guy
just
looks
sit
like
in
a
your mouth
guard.
and they go, eh.
I
They're
don't
all
have
over
any
social
experience.
media. You're looking
I
like you
don't
do
have
not.
experience on that.
No, okay. Tricky. All right. Okay. Any other questions of a more that was quite a specialized
Sorry. No.
question, but has anyone else got any questions? We've kind of been chatting nicely throughout. Was there any more in the chat that I missed? A couple of people have said they really like the way you put the slides together. So
Oh,
that's
thank you.
nice. That's
Thanks to
okay.
Annie.
Yeah, Annie is that Annie at your practice who put the slides together for you? Well, that's good. You can give her that positive feedback from all of us. Okay, so we're nearly at time, so I'll do our little general wrap up, and if anyone thinks of any questions in the meantime, we've still got a bit. Obviously we'd like to thank you so much for all that wonderful information and that presentation. It was really knowledgeable and it gave me a lot to think about. I feel like I just want to race out there and brush my teeth right now because I'm like, oh, what's happening in there? It's a microcosm of bacteria. But I'll restrain myself to the end of the talk. Are there any other resources that you could recommend? I know there's like teeth dot. Where would people go to find more information on this? Like I will send out the slides, the
So,
video, Dr. Sri's website, but is there any sort of resources that you recommend to your patients about general oral health and dental information? Where should they look?
I'll put it in the chat.
Yep, you can put it in the chat and you can send it to me as well, and I'll send it in the post email. But yeah, there's a few Australian Dental Association and teeth. That one's linked to the Australian Dental Association, is it? That's got some really good pro tips. As my son says, he's always like, I've got the pro skills. So you can get the pro skills from the pro tips website there.
So that's what I use for my family back in India.
Oh, you use that one? Okay, cool.
So when they had chaos, so I just sent this one.
Yeah. And obviously everyone, if this has raised any questions about things, you can get in touch and we can pass those on, or like first port of call, probably that your regular dentist as well is a good place to start. I know that normally in these sort of sessions I like to say there's this clinic and that clinic and this low cost option, but unfortunately with dentistry, like it's not always easy to find the low cost options, or the sort of public system can be quite a wait and things like that. So I think talking about prevention and maintaining great oral health as much as you can is probably like our best bet for cost savings really there.
Those as a practice, we really like to engage with the community. So we have been having a few seminars at Salt House.
Oh yeah, the community center there. Yeah, cool.
But the next one probably would be in Dixon Library.
Oh yeah,
I would
awesome.
be spending an hour, probably 1 hour.
Similar kind of topic to this, or do you have different topics that you cover?
So we are targeting different age groups, like
okay,
and school going and young adults and things
yeah,
like
pass
that.
them on to me and I'll share them on our healthcare consumers Facebook page and email lists if you like. Alrighty, so we've got obviously HCCA where I work has a website with lots of health information on there, and so we'll post that for you and send it out in the email. And we like to give everyone a little link to an evaluation survey that asks about, I think that there's like maybe 5 or 6 questions in there, like how did you find the presentation and can you give us any feedback and tips? And if you have a few minutes to do that, maybe tomorrow or whenever I send it out, that would be really helpful, because then we can keep these presentations really relevant, and yeah, that helps us gather that information.
And I want it personally too, because I want to, it's been a while since I presented something.
Yeah. And
So
it's a great topic,
like
and
evaluation.
Oh, Pene's popped in. Did you mean to do that, Penne?
No, hi. No, I just wanted to ask because Dr. Karumuri said they're presenting in Dixon Library to the community. Would you take requests from other community members, or if they wanted you to present to certain community groups? Would that be a thing?
Yeah, definitely please reach out to
I've got the contact details.
care.embassy.au. So that's our email. Yeah, so we are open to having those talks.
Penne has links into all the different multicultural communities in Canberra. All of them, Penne.
Yes,
and
and
it's a big, yeah.
Oral
Sorry,
health
you
is
go.
one of the biggest because it's not linked to Medicare and because it stops at 14 for children. So families with children above 14 say they don't see a dentist anymore. And yeah, so that would be really good.
Because it's very disheartening, even though as a professional, we love treating disease and to perfection, but it's always disheartening to see something going wrong, especially when my mom came to visit me. I did her checkup and took some x-rays. I found 10 cavities.
Oh, whoa.
And the simple reason is she looks after herself, she exercises regularly, there's dehydration. She likes to have some snack on nuts and all of that. They were getting caught in between the teeth. And when she had her dental checkup, they didn't want to take x-rays. Who was my roommate?
Did he get a rousing after that?
So it's like things just slips out of the crack. So it happens too quickly.
It doesn't take long to go wrong, and then you can be up for a lot of pain and a lot of money. Yeah, that's true. Any little tips, pro tips are probably helpful.
But I think
Okay.
that's where like when someone is educated in that area and they self-advocate.
Yeah. Yep. Absolutely. Well, I've certainly learned some new things tonight. I didn't know the thing about waiting for half an hour and like to remineralize, like do nothing and it will get better for that period of time. That's a new piece of information that I learned tonight that I didn't know before. And also about the different medications. I meant to put a quiz up, but I forgot. But there's lots of medications that are very common, antidepressants and blood pressure medications, antihistamines, a few things like that. You should always can check with the pharmacists and your GPs when they prescribe them if dry mouth is a side effect. And if you notice that, there is something that you can do, which I very recently only learned about myself. Like, who knew you could get saliva essentially in a spray bottle and that could solve. My son's teeth went wrong over about an 8-month period, and it was so quick and it was so expensive. And if I had known that the medication could cause that impact, I definitely would have been doing preventative things earlier. So I can see how this kind of information is really valuable. And yeah, little things happen and then pachung, 6 cavities, 10 cavities, tooth extraction. So, okay, might wrap it up there with 4 minutes to go. Our next one of these sessions is on self-advocacy in healthcare, but I'll send out some information and links to all of your emails next week, probably on Monday. And thank you all so much for coming. And I hope you've learned some great stuff and enjoyed tonight's presentation.
Thank you again.
Thanks a lot.
Yeah.
Good night, everyone. Bye.
No worries. Bye, everybody.
Yeah, thank you.
I love the waving part at the end. Bye. See you all drop
Bye.
off. Bye.